There's been a great deal of confusion regarding the use of PSA, prostatic specific antigen, as a test for prostate cancer. I'm Dr. Arno David Hausman, Chief of Urology at Phelps Memorial Hospital, here to try and clear things up for you and for people who need the test performed. PSA is an extraordinarily good tool for testing for prostate health. It is not necessarily a very good tool for testing for prostate cancer, although that is one of the things that we look at when we're looking at prostate health. PSA tests are an excellent tool, but if used improperly, clearly not a good tool at all. If you try to use a hammer as a screwdriver, you'll think hammers are no good. However, getting back to PSA, PSA is an excellent test to determine the state of your prostate's health. Generally, is a solitary test. It's not the same value as a series of tests, which is what we try to achieve. How the PSA changes over time, as it rises, as it falls, depending upon what the condition is and the treatment that's being given. We know that PSAs rise under certain circumstances, not all of them malignant. The PSA can rise if your prostate is quite large, it can rise if it's inflamed, it can rise if it's infected, and it can rise if you have prostate cancer. The absolute number, again, is not necessarily as important as what happens to that level over the course of time. Very low levels in very young men that seem to be rising even slowly may indicate an extremely aggressive, dangerous cancer, whereas extremely high levels of PSA in older men in their 70s and 80s may indicate just benign disease and nothing that requires any intervention at all. Therefore, it's quite important that you stay close in touch with your primary care physician and allow them to make the decision with you as to whether or not a PSA test should be drawn, first as a baseline study, certainly indicated for men in their 50s, and to follow over time, depending upon how the prostate feels or what your symptoms are over time. It is clearly a mandatory test for people with a family history of prostate cancer and clearly indicated in people who are at great risk for either neoplasm or an infectious process that is believed to be under treatment, to assure that that treatment has been effective. That will manifest itself in a return to normal of the PSA level after appropriate treatment. A continuing rise in PSA levels in an otherwise benign feeling gland may warrant further investigation with transrectal ultrasonography. And as the technology evolves, magnetic resonance imaging or MRI studies of the prostate may prove quite effective in determining whether a cancer of clinical significance is present or not. Clinical significance is the key. Clearly, disease of the prostate of a neoplastic nature, that is prostate cancer, present in younger men is highly significant, whereas the disease present in a 90-year-old man may make no difference whatsoever. Please keep this in mind. Trust your physicians. Go to your urologist if so indicated.